Hi everyone, I'm Dr. Dayan. I'm a facial plastic surgeon here in Chicago, Illinois, and I'm pleased and honored to be the Editor's Choice video series by Dr. Fouad Nahai for my article coming out in the September issue of ASJ. It's titled Safety and Efficacy of ATX 101 by Treatment Session, a pooled analysis of data from the Phase 3 trials. And this is based on the clinical trials that were used. The data was actually used by the FDA to gain approval for ATX 101. It was based on over 1,000 patients from both the Canada and US 3 clinical trials. And this led to the FDA approval, as I said before, for ATX 101, which goes by the name of Kybella in the US or Belcra in Canada. ATX 101 or Kybella is an adipocytolytic agent. It actually destroys fat cells. So unlike other treatment sessions that are done in the office, this one has a permanent outcome. And I want to touch on 3 points that you'll also be able to read in the article. The 3 key points that I identified in this post ad hoc analysis looking at treatment sessions to try to determine what works best clinically. What we identified is that in the first treatment, most patients got between 6 to 7 cc's of the product, and it was placed in the submental region. That's where we were looking for success and efficacy. And that number of volume went down with each treatment session. As patients started to lose fat in that area, they didn't need as much. So the key point number 2 that I want to mention is that by 2 to 4 treatments, most patients saw a meaningful outcome. 2 to 4 treatments is when they started to see an improvement. So although we were treating up to 6 treatments and each treatment was separated by a month, by 2 to 4 treatments, most patients started to see some improvement. And the third key point from the article is that the adverse events were quite minimal and most of them resolved, and they're mostly based on the treatment session. And what we noticed was quite a bit of swelling and inflammation after the first treatment, but that significantly decreased with each treatment. And it was based on the fact that there was less fat, and the inflammation was secondary to the debris and the fat that had to get removed. And we recognized with less fat, less inflammation, less swelling. So those are the 3 key points from the article. What I want to mention is that clinically, I've been using a lot of it in my practice now, and what I've identified is I'm extending the intervals. While I was doing it every month in the treatment sessions for the study, in clinical practice, I'm separating it by about 3 months, and I'm lowering my dose. While I was doing 6 to 7 cc's in my first treatment, now I'll do 3 to 4 cc's. And if I recognize that if I use less product, less volume, I extend my intervals, it's much more acceptable to the patients, less morbidity, they can fit it into the normal lifestyle, and it's been a successful treatment that I've now entered into my practice. So thanks so much for listening. I look forward to seeing you all soon.